Hey guys, welcome back to the channel. If you're new here, I'm Sebastian, a medical student from Australia. And welcome back to the vlog. I haven't done one of these in a while because I had exams about a week and a half ago. So I'm really happy that we finished all our theory exams. And the noise that you're hearing is that I'm currently going over an overhang bridge. I'm making my way to the bus, but we have clinical intensives this week. It's our second week of clinical intensives, and we're pretty much covering all the things that we missed earlier in the year because of the changes with classwork and online class. So I'm going to try to get a lot done. The bus has just about arrived, so I'm going to make my way to my first class. So, having a look at you, Mason, to make sure I can't see any obvious abnormalities. If you can just open your mouth for me and say ah. So I'm looking. Say hi, mate. Alright guys, so I'm back home and it was a quick one today. We finished at about 12 o'clock. We had the first session on lymph node examination and breast examination, and then we had a little bit of time to do some practice under supervised conditions. And then we had a quick interpretation session on arterial blood gases, chest x-rays, and blood films to make sure that we sort of know what to say when an examiner asks us, what do these mean? It's about 2 o'clock right now. I'm thinking of filming a new video, but my room is a little bit of a mess because I was scrambling this morning, so I'm gonna give it a quick tidy. So I'm ready to start filming my video, and I've got these set up here. I've got the camera over here. Got my little script, lighting set up, and I'm ready to go. Alrighty, let's get into it. I just finished filming and I'm uploading the files onto my computer now, so I'm going to check them out and scrub through the footage. It's getting a little bit close to the afternoon, so I might have a quick training session before dinner. I'm downstairs in our little home gym, and last week my brother and I got this power rack. And funny story about building it is we spent a long time putting in all the bolts and getting all the way to the end. And then we realized that we'd organized these pillars in the wrong direction. So we had to disassemble it, reassemble it, and the whole process took like 3 hours, but we got there in the end. But right now I'm gonna do a quick workout and start off with squats. Alrighty, time to put the weights away. Alright, so my legs are feeling a little bit sore, but I was looking at my to-do list before and it's kind of nice not having anything to do. We got tested on all our theory for the year a few weeks back, and so now it's just OSCEs. And so I might do a quick hour for some OSCE preparation, and then I'll just relax, maybe play some video games for the rest of the night.
Just another sunny day in Southern California. It's where the people came to play.
What is it?
Give us 5.
I think it's hyperlipidemia.
What's the first thing?
So BMI over 30.
Yeah.
And then you'd have increased waist circumference, hypertension.
Hypertension.
And the last one is it diabetes?
They commonly have diabetes.
Okay. Yeah, so we just finished up with our first class of the day, and it was the musculoskeletal system. We're going through how to differentiate between an osteoarthritis type of picture versus a rheumatoid picture. We're going over some of the things like the hand examination and how we go about the knee examination. So it was a good refresher. And right now I'm on a 15-minute break. We have our next class starting at 11 o'clock, and that's going to be the pituitary and adrenal gland. and I'm in a tutorial room, so I'm keeping my voice a little bit down not to disturb the other people nearby. But I haven't yet told you guys what this whole clinical block really is. So today is a Tuesday and we're the second week of a 2-week block, and it's to help us catch up on all the clinical skills that we missed because of online class during all the changes that happened in the last couple of months. And how it's being run is that every morning they'll have group sessions with the entire cohort, and what they'll do is they'll go through a different block or system. So last week we went through things like respiratory histories, how to do a cardiac exam, that sort of thing. It's more of the background theory to make sure that we know the structure, we know how to present ourselves. And then the afternoon sessions are more for us to actually practice and go about it. And as part of our clinical intensives, we also have to complete clinical exercises. And clinical exercises are like performing a mini exam or a mini history. And so they might ask us, "This is Mrs. Smith, can you please perform an abdominal examination?" Or "This is Mr. Smith, he's coming in with back pain, can you please take a history?" My class starts in 5 minutes, so I'm going to head back to the lecture theatre.
It's where the people came to play. Don't let them transform you. Come and see what you've been missing on a little slice of heaven. It's the only place we're living. It's that West Coast point of view. Easy when it's always.
It's only 2 o'clock in the afternoon, and the reason why class is so light for me today is because I didn't have my scheduled patient doctor tube where we go up to the wards and we get to have some patient experience. Right now, I'm going to try smash out a video edit to make sure that I have a video up this week.
It's been turning kinda gray in Southern California, but I'm allergic to the rain. What happened to euphoria? Oh, don't worry about it, don't worry about a damn thing. I'm too excited, dark liquor with the palm trees. It's all or nothing, ooh, it's all or nothing. Ignore the signs, it's all.
So it turns out that they have no stock of any of the donuts. So we had to result in a Krispy Kreme original shake, unfortunately. Deborah is sad.
Can see the sun. Side by side, our fears are done. Oh, the good times just begun. Oh, we know what we have, let's hold on tight. Found what we're looking for in life. Call us crazy, but things are finally right. With you and I, the future is bright.
Morning guys, so I just got to the hospital and our first class is on sexual health histories, and then we'll have a CEX clinical exercise drop-in session to do a bit more OSCE type of practice. So it's just at 8:30 and I'm going to run off to my class.
You and I, we got it. We don't need no more. Even in the hard times.
My scenario was to take a history from a patient with suspected chronic kidney disease. And so you have to go through the obvious things like why did the patient come in? And usually these patients might come in with fatigue, tiredness, and they might even have some sleep symptoms. So they're waking up in the middle of the night needing to go to the toilet. So that's nocturia. And you also want to be asking urinary symptoms. So that's having trouble passing urine. Is there any color changes? Is it frothy? Is there blood in the urine? Do they have a sense of urgency or dribbling or double voiding? And then what's important for CKD is to look at why it's happening. Is the patient severely hypertensive? Are they a diabetic? Because you can get diabetic nephropathy, or maybe they have a congenital thing like polycystic kidney disease. And so once you've sort of narrowed down what you're thinking the causes are, then you can go into family history, medications, the usual stuff, and you follow this schematic all the way along.
You and I, we got it. We don't need no more. Even in the hard times.
Having some lunch now, and outside, because the weather's actually picked up. It was raining in the morning, it was horrible drizzly weather, but now it's got better, hopefully it stays this way. After I finished, I stuck around for a bit longer to see how the other students went about their histories and exams, because I always think it's useful to have a look at what other people are doing well, or some of the common mistakes that I'll make or other students will make, so we can improve and learn. And because they can test us on pretty much any body system or any block, gotta be constantly practicing and honing those skills so we don't forget them. back on my computer and I finished processing a new video on YouTube, which will go live tomorrow. But this afternoon's been pretty relaxed. I did a little bit of OSCE preparation earlier and then did the video editing, and we finished up with dinner before we had burgers and they were absolutely delicious. And my girlfriend Deb also came over, so we're gonna wait until this food digests and then we might do a quick training session. Got off the train a little bit earlier and we've come to the markets. Didn't even realize they were on. Deb picked up some sugarcane juice and it's super tasty. We're heading over to the food court now and we're gonna grab some lunch. Just got to the food court and we picked up our meals. We're gonna dig into it. So this morning was really lazy. We kind of slept in. I did a little bit of admin stuff like replying to emails, but not a whole lot. After this I'm planning to go to my mate's house. So I'm gonna do a bunch of OSCE preparation for the rest of the afternoon. So hopefully we can revise all the things that we can.
You said it all the time, you never like that. Put it in the trunk and never write back. Got my like, it's tighter than facts. Keep my like, ay, oh. Teeth on my brain, you like to put it up.
Good to see you. It's been a long time.
It's been a
Well,
while.
it feels like it's a long time.
It's been like 2 weeks.
Yeah, 2 weeks. Thanks for picking me up.
No worries.
Yeah, shawty like the way I talk. She like the way I sing, the way I
Alright guys, so I'm at Declan's house and we're just setting up like our mini OSCE station. So we're just waiting on Alex and then we'll get started.
So I wrote out all of like the histories and exams and like procedural skills that we might get, and I've chucked them into these hats. And so what we're gonna do is like pull something out of a hat. So I might start with like a rheumatological history, like a back pain history, and then 2 minutes to think about it, and then we just do the station and then pull out another one. So it's just a quick way of getting through lots of different things that we might see in our exam next week.
So what I might do is I'm just going to touch your face with some various things just to test your sensation. So we'll start with this cotton wool. Just hold out your hand for me. Can you feel that?
Yes.
Okay, and we'll just do it on your sternum as well. Can you feel that?
Yep.
Okay, good. So we're just going to start by touching this on your face. So just close your eyes. Tell me when you can feel it touching your face.
Yep. Yep.
And was that the same on both sides?
Yep.
Raise your eyebrows for me. Close your eyes as tight as you can. Don't let me open them. Keep them closed. Well done.
420.
99. Okay, so hearing appears normal as well. Isn't it?
Bro,
Oh, damn, he gets this though.
no, he sucks. Oh. Is it my turn?
Yeah,
Hectic.
none of us have got it in yet.
Alright, do you want me to get it in or?
No, I want you to miss. Far out. Where was it from back here?
It's from that table. Gonna have a feel of your lymph nodes up here. Just starting with the submental lymph nodes, moving on to the submandibular, the parotid, the preauricular, postauricular, and suboccipital. And working my way down the anterior chain.
Because I was like, I did 2 and then I swear there was like 4, but I can't remember the other
So
ones.
then you do the 2 and then the other 2 are pronator drift, eyes shut, and then you can think eyes shut, and then you push down and see if there's rebound. And then rebound. Yep.
show me what we got.
Alright guys, we just finished having some pizza and we're gonna try smash out a bunch more histories before we call it a night. Okay, Can you tell me a little bit more about this pain that you've been having? Can you point directly to it?
It's just sort
And you said it's been happening for a little bit. How long has this been occurring for?
maybe like 3.
And what does the pain feel like?
Feels like a bit of like a burning sensation.
Is that pain in that middle region, does it move anywhere at all?
No.
And is there anything that makes it feel better?
Yeah, I've been taking some painkillers for it.
Okay. And is there anything that you do that makes it worse?
Yeah, when I tend to eat.
In terms of the severity, how would you rate the pain when it's at its worst?
Yeah.
From 10 being the worst pain you've experienced and
Probably
0.
8 or 9.
Okay. And when you... Hey guys, so we're in a tutorial room and we had an introduction session today, and it was like a Q&A about the OSCEs because we're having our OSCEs on Tuesday, which is in 4 days now, so it's very, very soon. And the thing about the OSCEs is that they only give you like 8 minutes. 8 minutes, right?
Yeah.
They only give you about 8 minutes. And so like you only have 6 minutes before you have to summarize. So trying to get through all the different steps in the exam can actually take some time. So you got to make sure that you're quite smooth with the process and that you practice it a lot, because if you haven't practiced it, it definitely shows through with your actual technique. And then we had a clinical exercise drop-in session. So my friend Mason and I, we went in and we performed a respiratory examination on each other. We got a little bit of practice. We both missed a few things, but we got some good criticism from our tutor. So we'll take it on and we'll keep practicing over the next couple of hours. And just some questions for you about your diet. So when you said that it comes on with food, what type of food is it?
So it's every food, like no matter what I eat, but it's just worse with like, I don't know, just the good food, you know, like Macca's and
these fatty foods, do you eat fatty foods often? Or salty foods?
I get them. Chicken has lettuce.
Okay, so just having a look at you, John, you appear quite well. Your skin colour is normal. I don't see a sallow complexion. I don't see any discoloration or jaundice, none any respiratory distress, and I don't see any signs of obvious muscle wasting. Okay, John, can you please just hold out your hands for me? Alright, so I'm having a look for palmar crease pallor. I'm just looking for any erythematous changes. I'm having a look at the nail beds. I don't see any clubbing, and I don't see any obvious leukonychia. So just going to have a quick feel of your pulse. Check for rate and rhythm. So that is class done for the week. I ended up working on my research project, and then after that we just went into the commons, and no one was really in the mood to keep doing OSCE practice, so we kind of just had some food and relaxed, and we are heading home. Dinner will be coming up shortly. Hey guys, so I just got up from a 3-hour nap and we are going to watch Rebecca on Netflix. So if you guys have any suggestions for some Netflix shows or movies, put them in the comments so we can binge something on Netflix. Hey guys, before you click off this video, I wanted to talk about something a little closer to home. So some of you may have seen my most recent post on Instagram where I talk about unexplained cardiac death, more commonly known as sudden cardiac death. Well, recently one of my best mates tragically lost his 21-year-old brother Luke to unexplained cardiac death. And I felt it was really important to raise some awareness about it. So if you don't know what it is, UCD refers to an unexpected cardiovascular event that leads to death, and it's triggered by an electrical malfunction in the heart that causes an irregular heartbeat, or in medical terms, an arrhythmia. And what's so scary about it is that it affects those who appear to be fit and healthy, and there are often no signs and no symptoms. The causes of UCD are still largely unknown, and there isn't nearly enough public awareness about it. If you have the time, I'd strongly encourage you to read up on my Instagram post or to follow the link in the description below to learn more. I know this isn't how my videos usually end, but I really appreciate you sticking around and listening. This is something that's important to me, and I hope more attention will be brought to it. On a more positive note, I hope you guys are keeping well and looking after yourselves, and I'll see you in the next one. Peace.